Hi, this is Dr. Rosenberger from Appalachian Spring Dermatology, and today we're talking about cysts. So people come into the office, patients come into the office all the time, and they'll say, "What kind of cyst is it, doc?" And I say, "Well, I don't know." And then they look at me and say, "But you're a dermatologist." Well, there's a good reason why I don't know, and I'm going to explain to you why. So there are three types of cysts generally: an epidermoid cyst, a sebaceous cyst, and a Pylar cyst. An epidermoid cyst occurs when there's like an invagination of the skin. These can occur sometimes from a blackhead, from a piercing, from some kind of injury where the skin surface has invaginated, made a little pocket, and then that pocket closes off. Okay, that's an epidermoid cyst. The second type of cyst is a sebaceous cyst, and that grows off the oil glands. The third type of cyst is a Pylar cyst, and that grows off the hair follicle. So you actually can't tell what kind of cyst it is until you cut it out and see under the microscope, microscopically, what the lining, so the cyst is a sac, and the sac has a lining. So the lining of the sac is different with those three different types of cysts. So depending on what type of cyst it is, you'll see different types of cells lining the interior, the inside of that sac. So the next question is it cancerous? Generally, no. So I have been doing this for a long time, almost 20 years. And in 20 years, I've seen two patients that have had a cyst that had a cancer inside of that sac. So with the lining of the sac, a cancer can grow within that wall of that lining, just like it can grow elsewhere on the skin. But that is the exception, not the rule. We always, anytime we take a cyst out, we send it in for it to be examined microscopically to make sure that there's no cancer there. But 99% of the time, there's no cancer there. So that's why when you ask me what kind of cyst is it, I can't tell you until we cut it out and look at the inside. A lot of times people say, well, if it's a Pylar cyst and it's on the scalp, if it's on the scalp, it's probably one of those hair ones, right? It's probably a Pylar cyst. Not always. We see all types of cysts and all types of locations. Now, just as an aside, it's very uncommon to have a cyst on the palms or soles of your feet because we don't have usually oil glands or hair follicles in any of those locations. So hopefully that answers some of your questions about cysts.
Call for an appointment today and learn more by going to our website at wvderm.com.